Thank you. We are live. Ladies and gentlemen, we are sorry and apologize for the technical difficulties getting us started. But once again, it's part two. Representative Kionne McGhee, leader of the Democrats in the Florida House, Representative Shevrin Jones, and myself, State Senator Bobby Powell, the chairman of the Florida Legislative Black Caucus. We are excited once again to join you all to discuss what is happening in terms of coronavirus with an update. As we told you last week, all three of us came into the Florida House together. Since then, we have done different things and going on to move into terms of leadership. Some of us running for the Senate, others are on their way to the Senate, and we are now here with you tonight to give you an update on the coronavirus or COVID-19. As you do know, we're going to get into a few things. We're going to get into the governor's press conference today. We're going to get into the Florida Legislative Black Caucus Zoom press conference that we had earlier. I'll also discuss a little bit about the Senate Democrats and what we have in store for tomorrow. I believe it's tomorrow. We have a press conference at 1. Just a lot of things that we're working on. And we're going to give you an update on the pulse of where we are in terms of the districts that we represent, which are Broward, Dade, and Palm Beach County. So once again, I am State Senator Bobby Powell Jr. representing Senate District 30 in Palm Beach County. Quick update for what's happening in Palm Beach County, and then I'm going to pass it on to Representative Shevrin Jones. Total for the state of Florida, there's 33,193 cases of coronavirus. In Palm Beach County, that equates to, pull up my numbers here again, a total of 2,911 cases of coronavirus in Palm Beach County. 2,850 are residents, 2 are non-residents, and 2 are not in Florida, and 59 are non-residents. We've got 178 deaths related to coronavirus and 416 hospitalizations. What we've told you, demographic information previously indicates that, and just take this in stride, about 44% of the data here, 48%, almost 50% of the data in terms of ethnicity is unknown. So it's very difficult to give you accurate numbers because we have I'll just give you the numbers that we have. 369 Blacks have had coronavirus here in Palm Beach County, 1,022 white, and 204 other. So if you really calculate that in terms of what we do know, you end up still having about 24% of the Black population, which is much higher than what we have in the county of those getting coronavirus. What we've indicated previously is that in the Black community and other states, it's been a huge detriment. And we said that wasn't happening in Florida, but Representative Jones, when you get to Broward County, tell us what you see in terms of the numbers. And we're going to go to Representative Shevrin Jones. To you, Shev.
Hey, Shev, you can't take him anywhere.
Listen, I'm trying to be serious because I'm trying to give. I definitely want to give the report of where we are in Broward County. Currently in Broward County, we have 4,794 cases, but we have 867 people who have recovered from coronavirus. We have 174 deaths. And I know the hot topic for tonight will probably be the reopening of portions of like parks and marinas and things, and what does that mean? And even the governor's press conference today with opening up reopening up half of the state with restrictions compared to South Florida still remaining closed in certain areas. So I know in Broward County, Palm Beach County, and Miami, all the mayors have come together to speak to the necessity of why it is important for all of them to coalesce together to do this united front in how we approach the opening of our counties. But I think the biggest thing I don't think any of you would disagree with me is that the most important thing is it being done safe? Do we have enough testing locations? And what are we going to do about unemployment? And what are we going to do about those small businesses who practically are waiting for some type of assistance to ensure that they are able to open back up. So I'm looking forward to the conversation today. I think that I will not be in a safe place of us how we're moving forward as a state until I know that there's adequate testing for people that would give us true data, which to Chair Powell, who's the chair for the Black Caucus, as we have been asking for. I won't be safe in saying that we're good until we know for a fact that we are on a path of recovery and ensuring that there's enough testing locations within the counties that will allow us to open up safely to make sure that people around individuals who are affected are safe. So it's on you, Leader McGhee.
Hey, and Chev, let's be absolutely clear what you brought up and what you and Senator Powell brought up also. Look, it is real. And, I guess we're going to get into that. I know we're going to get into that discussion about whether or not opening up the state, even incrementally, is the right thing to do, and whether or not it's going to prolong any substance for our individuals and our members of our families and friends who've been affected as it relates to the unemployment status and then also receiving their benefits, their reemployment benefits. So obviously that's going to be something that we have to look at and we have to deal with. But I'm with you on this one. The real question that's really going to come down to is, are we really ready to open this state? And from the emails I've received today, I can tell you many of the people have been basically saying, Kionne, are we ready? And that is real. So let me just say, I know in Miami-Dade County, we have over 338 deaths. We're hovering closer to 12,000 positive cases. We're somewhere around 11,700. And at the end of the day, we have about 1,500 people roughly who are hospitalized as it relates to COVID-19. So that's where we are right now. And I echo everything you said, Rep. Jones, that at the end of the day, we need to know, if there's going to be more testing and how is this truly going to affect Miami-Dade, Broward, and Palm Beach, considering the fact that, we're donor counties. And, some people are making an argument that we're not being similarly situated as the remaining counties who are able to do business, who are able to open up and bring in more resources into their economy, while Miami-Dade County, Broward, and Palm Beach are forced now to take a back seat. But again, that's part of the discussion we're going to have tonight. So look forward to it. Let's do it.
Hey, gentlemen, I want to thank both of you for that. Here in Palm Beach County, we're a little bit different. I know our mayor, David Kerner, and county commissioners, Mac Bernard, Melissa McKinley, Robert Weinroth, Greg Weiss, and Hal Valashay have gotten together and have decided that we are phasing our opening. So they've opened some of the passive recreation, such as the parks, but they have not opened the basketball courts here in Palm Beach County. They've opened the boat ramps. They've also opened golf courses, and they still want to maintain that social distancing. But in terms of the numbers, Rep. Jones, what I've seen is in Palm Beach County, I told people earlier that we've got nearly 50% of the population that has been tested that are unaccounted for in terms of racial data. For you all in Broward County, that's a very, very low number. You all have about, I think, 9% of your population that hasn't been hasn't been tested, but is unknown. But when you use that 9%, if you look at Broward, you see that more than 30%, 33% of the cases of coronavirus in Broward are of the Black population. And also what we find is, after talking to Dr. Cynthia Robertson on one of our conference calls, we found out that 36% of the people who are dying in Broward County are Black. And what we don't know is, there's an article that hit the news today showing us that the medical examiners are putting out data related to the individuals who are dying from coronavirus, but the state information doesn't match the information coming from the medical examiners. So the state has asked that the Florida medical examiners, those who from the different counties who are putting out data, stop doing so that the state will now put out the data. So what we're seeing is somewhat of a mismatch in terms of classifying deaths by coronavirus. Let's talk a little bit about the governor's reopen task force. I've got my trusty dusty computer here where I had pulled up earlier the list of things that the governor had announced would be opening. So once again, he's going into phase one of the reopening of the state of Florida. And in phase one, Miami-Dade, Broward, and Palm Beach counties are excluded from phase one. And Leader McGhee, as you may know, of the 33,000 cases in total, I understand that more than 75% of the cases in Florida are inclusive of Miami-Dade, Broward, and Palm Beach. But more than 1/3 of those cases of coronavirus in the state of Florida are Dade County in itself. So Dade County has a higher number of those who've been tested positive for coronavirus. So just a quick update while I've got this up with regard to the governor's reopening. I'll tell you this. This is phase one. And in phase one, he issued Executive Order 2011. He wants to know that schools will remain at distance learning. Visits to senior living facilities are still prohibited, so we're slowly phasing in. Restaurants may offer outdoor seating with 6 feet between tables, and indoor seating at 25% capacity. There's been no change of bars, gyms, personal services such as hair salons. That's why I got my COVID-19 hairdo here. All individuals in public should maximize physical distancing from others, avoid socializing in groups of more than 10, and also face masks are still recommended when we're going into phase one. So that's what phase one looks like. Remember, we're left out of phase one. What are you all seeing in your counties?
Well, I can tell you what I'm seeing here in Miami-Dade County, Senator Powell. That was a great exhaustive. It wasn't really an exhaustive list, but you list off exactly what we now know. Phase one is basically saying, look, Miami-Dade, Broward, Palm Beach, sit on the sidelines until you get your act together. To all the rest of the counties, these are some of the things we want you to look into. You know, continue with this, distance learning with school. The visiting of the senior living facilities are prohibited. And so you look at restaurants like you mentioned earlier, but this is more so to get the rest of the state back on track, hopefully into phase two sometime soon, which they have dubbed the new normal. But that's exactly what you stated. What you stated is exactly what's happening, with the exception of Miami-Dade County and Broward. Keep in mind, once this goes into effect, I think we'll be able to see the true results from it. Now, there are many people out there who have different ideologies, different perceptions on what may happen, whether or not we open too soon and whether or not we need more testing. But, you know, I've always stated that, you know, numbers don't lie, people do. So we just have to wait until we see the numbers before we make a clear assessment of the damage or the benefit that may come away from opening now.
Yeah, and I don't disagree with Leader McGhee at all. I think but we also should look at this from a step further. That you look at why South Florida is not open right now, and this is one approach that I can actually say that the governor did right. I mean, and this is just me. Now I don't know what you all think, and as far as not opening up South Florida, considering the fact that we have so many cases right here. There are individuals who are looking at how does this look as we prepare to reopen. And it doesn't just come from the governmental section. It comes from even the educational sector. Dr. Hardwick from Florida Memorial, the president of Florida Memorial, he wants to participate in creating a better outlook at how we open up the economy by putting more testing sites, even utilizing Florida Memorial as an opportunity to do it. You have individuals who are a part of government, but they're in the advocacy part, like individuals like Yolanda Cass Jackson, individuals like Dr. Brente. You got all these who are all these individuals who are like, how can I help get us back on track? And how can I ensure that what we're about to do in South Florida, that they can play a role in it, and from all of these aspects that's within our city. I will say that even on the task force, I am happy that we do have one person. We have Representative Omfroy, who sits on that committee. But I want to say that there should be more people, even from the South Florida area, to be a part of that conversation as we prepare to open up the city. It allows for a more robust conversation, a balanced conversation, and how it looks for us to get not just the state back up and going, because considering half the state has opened up without us, but to eventually get South Florida back up and going.
I'm glad you said that because I want to get into something real quick, and it might be a little bit controversial, and it's controversial for you two at least. Well, not anymore because it doesn't affect you anymore. Your immediate past speaker, still the current Speaker of the House. If we end up in a special session, Speaker Oliva will still be the Speaker, just like Leader McGhee is still the current leader for the Democrats. Your counterpart, Leader McGhee, has said, and I'm not going to quote specifically, but basically it's criminal that we shut the state down and all these businesses had to close. These businesses should still continue to operate. And this pandemic, it's in a crisis in terms of economics. So we need to immediately open the state back up. Now, remember, Speaker Oliva is down there with you in Miami-Dade. And on a personal note, I get on very well with Speaker Oliva. We do have a difference of opinion on that particular issue. But what do you say to those who agree with Speaker Oliva, who are saying, guess what? It's criminal to have the state closed down. Businesses need to operate and we need to get people back to work. And I say that because what I'm looking at is I'm thinking about those frontline workers. So Leader McGhee, what do you say to that?
What I say to everybody else when they have their opinions and assumptions, I leave them where they are. I deal in facts, and dealing in facts, you come to realization really quickly that you stand on those facts. And right now, I believe when you have a debate between democracy and capitalism, it's for the people, by the people, of the people. And so when you're talking about the economy versus the people, I tend to side more with the people. I believe the people will never lead us in the wrong direction. I believe we have not only a constitutional duty, but we have a moral obligation to protect the people that we were sworn in to represent. So, what his position is at this moment is his position. But what I do know is, as for me and my house, and for the folks that we represent and the folks that we want to push forward, ensuring that they're receiving their unemployment benefits, they're receiving the proper protection gear, they're receiving the right access to healthcare. That's what's important to me. And Senator Powell, me more than anything, that when it comes down to statements from others, if it's not there to really push us forward, I tend not to give it as much weight. But again, he has his own opinion. I have my own opinion. And right now, my opinion is this. There's a fight between democracy and capitalism. And right now, I'm standing with democracy.
Rep. Jones? He said he hit it right on the head. Well,
he did. I mean, at the end of the day, I think the speaker the Speaker of the House has his right to say what he has to say, but you don't have a right to veer off from the truth,
right?
And you can't veer off from what the numbers actually say, right?
Correct.
Which we can do this if we wanted to. I mean, we can speak about what's criminal and when it comes from Washington D.C. and how this was handled. If we want to do that, because we can, because there are over 60,000 people whose lives have been lost because of how we have broached this subject. And as you all know, I mean, Kionne is the speaker, friend of Kionne, and he's a friend of mine. And just because we're friends don't mean that I can't disagree with you in your approach and how things are done. I mean, at the end of the day, if we had not done what has happened, then we would be in a much different situation. We would be in a worse situation than we're in now. And even some of the pressure that we had put on the governor's office for what has happened, I mean, it was necessary, and it wasn't as if anybody was trying to gain political points from it. It was because it was the right thing to do. We knew what our communities need, whether it was from asking for testing sites or whether it was asking for us to shut down cities just a tad bit sooner. But everyone have their right to make the opinion, but you cannot veer off from what the truth is, and the truth is in the numbers. The truth is that we know for a fact that 33% of African Americans are dying from coronavirus because of the lack of testing sites that's here. We know for a fact that the case numbers that are currently being presented are coming because we failed to shut the state down in a timely fashion. So again, you have all rights to say what you want, but you can't veer off from what the truth is.
Hey, look, and let's be absolutely clear here, and great job, Rep. Jones, on how you couched it very well. Look, in 1918, when the influenza was here in Miami-Dade County, let's think about it. Put all this stuff into true perspective. If we're really going to go there, we're going to go there. In 1918, what was happening in 1918? We do know that African Americans didn't have access to a hospital, right? We do know that African Americans suffered at a higher rate proportionally based upon the population and based upon the fact that there were laws in place that prevented us from actually having access to hospitals. We didn't have a hospital then in 1918, right? We had to literally, D.A. Dorsey literally donated land in order for us to have hospitals created for us to get access to some healthcare to deal with the influenza that was going on. So when we're talking about the effect of COVID-19 on our people, it's really interesting because we are Black, and being Black is something that we are 100% 24 hours every day of the year, every day of the week, every waking second. And if we're going to look at this from a historical standpoint, we have to look and see what the past has shown us. And it has shown us every time everyone else gets a cold, the African American community gets pneumonia, and we suffer the most. And so when people are rash to their decisions and on what we should do and how we should do it, I tend to look at history as a teacher here. And if once history tells me otherwise, I will believe otherwise. But right now, the medical community, the history books, and the numbers that are on the books are telling me right now that my community will continually suffer if we don't change the direction that we're heading in. And we don't want a repeat of 1918. I believe the number said that it wiped out 30% of our population here in Miami-Dade County. And so that's why I'm very reserved in my response when people make statements about this particular virus, because I know what history has shown us. And if we're not careful, thus far, what we've seen the over encroachment by this coronavirus into the African American community to the point where the numbers that Representative Jones brought up are very daunting and haunting, and quite frankly and quite naturally, let me say this, it's insulting, because we should have known better. There are just too many experts around this country who have already predicted how this would have had a huge impact on our community. Look, I said it before, and I believe it was Mr. Russian at Hot 105 who stated it, right? The COVID-19 is a bully, and that bully attacks those who have medical issues, those who are in poverty, and those who are not in a position to fight with their full strength against it, economically, physically, psychologically, and sociologically. So that's my point. That's all I got to say. Sorry if I overstepped.
Good stuff. I want to say this real quick because Representative Jones reminded me last time, each of us has a number of people who follow us on Facebook, Instagram, and all those other things, TikTok. I'm not on TikTok yet, but I want to make sure people can share this video.
Hold on. Did you say, I'm sorry, Senator Powell, did you say Shevrin Jones have a TikTok video out?
I have a TikTok account.
He's got it. You didn't see Don't Rush? Look. Well, nothing changed. But anyway. So listen, please share the video. If you are on my page, share it, because there's some people who you may know that don't know, and they can get this information. If you're on Leader McGhee's page, please share. And if you're on Representative Shevrin Jones' page, please share this Facebook Live so that other people have access to this information. We're gonna dig in a little bit. We're gonna try to end. We were gonna end at 10:30, but since we came on at 9:40, We're going to end right at 9:40. So we want the opportunity to answer a few questions. It's 10:40. Opportunity to answer a few questions from people as they come in. So we'll get those questions. But I do want to say great points that you both made with regard to that. But let's talk about what we are doing. What are the things that we're doing in terms of moving forward, not just for us, but the state of Florida completely. I will go ahead and mention this, that myself, and I'm just going to speak for me. I'm not going to speak for Leader McGhee or Representative, soon-to-be Senator Shevrin Jones. But for me, I did not run for office to be rich and wealthy. If I would have wanted to be rich and wealthy, I would have not pursued public office, right? Because there's so many other opportunities that will get you wealthy. I'm in public office to protect the people who I'm here to serve. I represent about 500,000 people in Palm Beach County, and my people span from Democrat to Republican to homeless to those who own homes, from those who are the wealthiest people in the state of Florida. By the way, I do represent Mar-a-Lago. So I am the president's state senator, and I represent some of the poorest people. And yeah, that's right. That's my constituent. Let me know if you need something.
Donald Trump is your constituent?
That's right. He probably won't be voting for me. But
You know what, Senator Powell, we could just stop right there and just have a conversation about that.
let's
I guess the question is, how many press conferences you've been invited to?
by who? The president?
No, he's not just your president. He's your constituent.
Oh, he's busy. So you know how that goes. Listen, and truth be told, as we've continued to work, we have a good working relationship with the governor's office, although he does forget to call me when he comes to Palm Beach County, but I still find out and I go to his events. But I'm in constant contact with the shade in the house. I'm in constant contact with Secretary or Director Jared Moskowitz, on the phone all the time with Stephanie Capeluso, who is giving me great information from the governor's office and communicating back and forth. Dr. Scott Ribkeys, Dr. Robertson, they've been very helpful. I've been able to communicate, and they've gotten information to the governor that has allowed things to happen and change things. So I will commend him on that. I know this is a very difficult task for him to handle for the entire state, and many people will agree, and I'll agree. There's been some places where he could have had a lot of improvement in terms of handling this, but I don't want to jump into the weeds of Democrat, Republican, the political things that people have been trying to do. I am trying to get help for our people. So I say that to say this. They are expanding testing throughout the state of Florida. The governor announced today that they've got some mobile testing going on. Here in Palm Beach County, we've done some pop-up testing in West Palm Beach and Riviera Beach. Tomorrow at, I think, 11:30, myself, Representative Jaquette, Commissioner Mac Bernard, the City Council from Riviera Beach, Doug Lawson, Trodrick McCoy, and the Mayor Ronnie Felder will all be in Riviera Beach announcing the opening of a new testing location in the city of Riviera Beach, along with the Florida or the Palm Beach County Black Nurses Association. So that's exciting. That's what we're doing here in Palm Beach County. We're getting more testing sites. The governor's office, the executive office of the governor, and the secretary of, or the director of emergency management, they've been putting testing sites in our communities so that we can know who is testing for coronavirus and know who has it, so that we can really show that we're flattening the curve. And for us, that's super important because, like I said, I represent some of the wealthiest communities in Florida, some of the wealthiest residents, and I also represent some of the poorest people. And on that same token, I've broken bread with billionaires, meaning I've sat at the table with people who have $1 billion or net worths of $1 billion. And I've also sat at the table with people who their belongings they can put in a book bag and they don't have a place to live. And that's the spectrum that I look at. And that's how we have to move forward. So we're getting more testing sites. What are you all seeing in your areas?
Well, I mean, quickly in our area, in my area, I know we in Miami Gardens area is the closest area to where I represent as far as West Park area. we do see an expansion of who the people they are testing, to where they have now taken restrictions off of the people who are able to get tested. CB Smith Park is still an area where an individual can get tested. And I know they are doing some mobile locations. We are still looking on how we can put to take some of the burden off of Miami Gardens, because if you drive over to the stadium at 8, 9 o'clock in the morning, the line is wrapped around in various locations. And so access to testing, it also requires making sure that it's somewhat convenient for people, because let me tell you what will end up happening. You all know this, that when people start seeing lines like that, you're going to start seeing an influx of people start going to the emergency room to go get tested. And so then your emergency rooms are going to start getting flooded with people. So it would behoove us as a state to ensure that we put more testing locations, so we don't put burden on hospitals. And so, and that's the tip. I will be honest, that's what we're seeing right now. We're seeing that you have these long lines and people don't want to wait. And so people they don't want to wait in those lines. So people are going to say, hey, well, listen, I'll go to the hospital to get tested, go to the emergency room to get tested. And so which is not what hospitals need right now. You're on mute.
You're muted, Kionne. Or are you just moving your mouth and not making words?
Shevrin, what are we gonna do with him? What are we gonna do with him?
I don't know.
So you need to restate everything you just said.
No. Actually, I wasn't saying anything. I just wanted to check it out to make sure you understood what the words that were coming out of my mouth. But no, the reality of it is this. In Miami-Dade County, you're seeing the same thing, similar to what the two of you have stated. We're seeing actually a little more testing going on. The one thing that I really want to bring up, because it was almost as if it was pushed to the side and nobody really wanted to touch it before, is the reality that, COVID-19 has also shown us that there's a class misunderstanding here in this great county. And I'm sure you all have seen it in Miami and Broward and Palm Beach. I don't think a car should be the requirement in order for you to know whether or not you are affected with COVID-19. I think that's something where we should have had a contingency plan in place early on, that for those who could not have afforded a vehicle, should have been allowed to go somewhere to be tested. And hopefully, in the future, if something like this ever were to come about, we should be in a better position to say that we are not going to, stand up first to those who are privileged to have a vehicle versus those who are not privileged and doesn't have a vehicle. So obviously, COVID-19 has shown us some places that we can work on and improve. And I believe with great minds like you two, and others who are in this great state, that we can actually push forward to have some sort of plan in place for the next time. And that way we know that our people, the ones who elected us, who are our bosses, are not going to be chosen for some screening process based upon whether or not they have a vehicle. I think there's something fundamentally wrong with that approach. I understand why we did it, but I think at the same time, we got to do a better job. As it relates to Miami-Dade County and its approach early on, you talked about death not being reported by the medical examiner's office at the behest of those who are in Tallahassee. There was a report that came out about that here in Miami. I was one of the first ones to flag that discrepancy as it relates to the numbers. I noticed that the numbers that were coming out of the medical examiner's office were not the same numbers that were being reported by the state. I did speak with the county and asked them why there were discrepancies there with the numbers. I was informed because, what the county was reporting were the numbers directly from the medical examiner. And as you're aware, the medical examiners, normally it wants to know what the cause of death, the age, the name, the race. And so they were reporting those names and that information as quickly as they were able to. But where it went left or right, I don't know. I'm not going to get into the business of speculating here, but what I can say is let's continue to work together, all of us, to ensure that our bosses, those who've elected us, are in a better position than they were yesterday.
I appreciate that. I think you're right on target. Let me mention a few things. That way people know information that we're giving out. From today's press conference, the Department of Health is working with the Board of Pharmacy and Florida's Department of Business and Professional Regulations on mobile pharmacy compliance guidance. We're also seeing that the Department of Health is utilizing rapid emergency support teams to expand testing capabilities in long-term care facilities. That's been a big problem in Florida. One of my sisters today, I was talking to her and she was telling me about what we've seen in long-term care or assisted living, and there needs to be more testing there for those people because we know what's happened here in Florida. Now, the Department of Health did announce that a list of long-term care facilities in Florida associated with COVID-19 cases will now include active cases in each facility in order to provide real-time data. Now, this list of long-term care facilities with active COVID cases will be available on the Florida Department of Health website. We're also seeing that at the direction of Director Scott Ripkeys and Governor DeSantis, they announced here in Florida that they've ordered an additional 2,500 test kits as resources to be readily available for some of those walk-up locations as well as some of those mobile testing sites. So that's what we're seeing here in the state of Florida. Gentlemen, I think we do need to switch we're running close to our time to talk a little bit about and I'll let you all piggyback off of what I just said, but we can switch the conversation a little bit about what's going on with unemployment. People need to eat. People have not been getting their unemployment compensation. So if y'all want to piggyback off of that right before we jump into this conversation, but this is a conversation that we really need to have.
Well, I'll say one thing and I'll be done with it. Secretary Satter, I know that his department, I know they're working on it. I know there has been a change in leadership who is working to resolve the issue that we know for a fact is an issue. But I think we need to take this a step further, right? And we need to be honest with what is happening. What we have right now is a state who has neglected the people of this who live here, reside here within the state of Florida. And I believe it sets a dangerous precedent to where even when we do get the state back up and running, there are going to be people who will not be able to get back on their feet in 1 week, in 2 weeks, in 3 weeks, and even in a month. And if we as a state cannot even be trusted in how we handle people who have gone through this type of economic turmoil, and all we can do is give them time and time again is excuse after excuse, the lack of phone calls, not responding, hanging up on individuals who've been on the phone for 80 minutes, individuals who were eligible now all of a sudden find themselves ineligible. What kind of faith does anybody have within a system or within a state that says that we're going to take care of you as a people? I get it. I mean, we could continue to make this excuse that the system was made to fail. I mean, but that runs out. It runs out at a point in time to where we got to figure out, what is the best route that we should be taking to make sure we take care of these individuals. And I'm gonna give it to Leader McGhee, but I'll say this, that people are sick of the excuses because Friday is coming and April 1st is on the way also. And people are about to go into another month. And May 1st, excuse me. Thank you so much. May 1st is coming and people are not going to be able to pay their rent. And are we going to give them another excuse on why we cannot help them? It's unfortunate. And we talk about malpractice, but not only is that irresponsible, but that's malpractice and irresponsible on our part.
Leader.
Rep Jones, I don't know how to follow that. That's why I hate following you when you speak. You have a way of putting it out there,
I hate
man.
following both of y'all. That's why I went to the Senate. But anyway.
Sorry.
Oh gosh, man, you're too much, man. You're too much. Look, the only two words well, 3 words that Rep. Jones missed out, and I know he was going to it, but he wanted to throw me a alley hoop. Is class action lawsuit. That's what you're going to see, because now you have elected officials who are on the record who are saying that the system was broken. Then you have other elected officials who are actually blaming the previous administration and saying that it was deliberately done. And then on top of that, you have individuals who are now saying that not only was it deliberately done to fail, but there are records within emails of those who were in power at the time. So there are public records requests being made for individuals who were part of that administration. And so with all of that, now there are lawsuits that are currently filed, especially in Tallahassee, where you have similarly situated people who have suffered similarly due to the negligence and the bad behavior of those who were in power, who were held in trust to create a better system to work. Now that we know, based upon what we've seen in the research and in the reports, we now know that there may have been a deliberate approach to keep these numbers down previously, and now that's why you have a broken system. Now, that's real. That is real. And so part of my show today, I talked about it, and I said, Rep. Jones, like, I once heard and read somewhere where there is a conflict between what you see and what you're being told. Yeah. Just remember, mama didn't raise any fools. Right. And right now, May 1st is quickly approaching. People are going to be asked to go back to work. Restaurants and department stores can only maintain capacity of 25%. Now, if you look at that from a standpoint of your analysis, then that means that restaurant staff or the retail department stores are not going to be required to use their full staff anymore, which means there's going to be a cut there. So now the question is going to be, what happens when the restaurant or the retail store keeps you on as an employee, reduces your hours to 4 a week? Are you now still going to be able to qualify for unemployment benefits? Technically, you're not fired. Technically, you're employed. So what are we truly seeing here? So you're going to see, in my humble opinion, a rundown that can be very bad. It's going to hurt a lot of people. And if we don't get ahead of this thing, we're going to see some bad things that are going to come away from what we've seen and what people have been able to do or what they haven't done.
Well, leader, I agree with you. And what we've seen is that even the phased reopening of the state, we don't know what that will look like, but you got to think about this. And this is one of the things that's been given to us as well, that layoffs that will come due to the loss of revenue for government employees hasn't had any attention yet, because that is coming as the revenues start to dwindle up the state. Right. And we've been in positions in the state where we have frozen positions. Luckily, I used to work for a state representative back in the day when I was young, before I got elected.
Hold on, did you say you used to work for a state representative before you were, when you were young and before you got elected?
Correct. So you caught it. So to say this, they had to deal with, at that time, they had to deal with a deficit in the budget. Since we've been elected in 2012, I'll call it the luck of the McGhee and the luck of Jones, because when y'all came in, we weren't in a budget deficit. We actually had a surplus when you all came in. We were to put money into reserves. But previous to that, we had to cut positions in the state. We had to, and I came in with you all, but I was here to look at the budget with my predecessor. Shout out to Mac Bernard, everybody, county commissioner. But anyways, we were cutting, and that's what we're probably gonna see as we move forward. Let me say this came out today as well, that the DEO's call center and claims processing system were overwhelmed. The weekly call volume had jumped from about 27,855 in mid-March to 864,313 by the end of the month. And the average time, you said it, Rep. Jones, that people were on hold. You said about 80 minutes. Yep. That's those people who told you. But there's been people who had waited on hold for 400 minutes or 6.5 hours and still weren't able to get through or were cut off. So what has happened as of April 5th, you know, that the Florida Department of Economic Opportunity signed a contract for $79.9 million with the Fort Walton Beach company to provide at least 1,000 operators to help get the system working. That was April 5th. We're at April 29th, and it's still not working. It's still problematic. Now, I will say Secretary Satter is working. Leader Gibson, Audrey Gibson, has been to Tallahassee and saw the operation, as well as Senator Darrell Roussan have been there. So I'm confident that the system is starting to move, but we gotta move it faster. We spent over $180 million to fix this system. And I think if you spend $180 million, we, like you said, Rep. Jones, we don't need to pass the blame. We need to get these checks to people.
Hey, Rep. Jones, wasn't there a movie out one time and there was like a phrase like "show me the money"?
You're dating yourself.
Yeah. What's the name?
I am.
Jerry Maguire.
What did he say?
Show me the money.
Show me the money. And that's the mantra that people are going to subscribe to from this point forward. You know, excuses. Okay, right. Well, excuses. Okay, yeah, right. Well, excuses. Yeah, okay. Man, just show me the money. That's what it boils down to. You know, don't tell me you don't have it. Don't tell me it's coming. And if you tell me you can't show me the money, then you need to go find me my money. And if you can't find me my money, then we got some issues. And so people are rightfully upset right now because the system has failed them. And let's be absolutely clear. Stephanie in the governor's office, wonderful job, right?
Yep.
Secretary Satter, great job. Shane and all of them, Jared, great job. Listen, I got no bones to pick with any of them. They're doing what they can do with what they have. But at some point, that honeymoon will probably be over as it relates to the people, because the people are saying, listen, okay, we gave you a honeymoon period now. We get it. You know, you when you came in, you inherited this system. But at some point, the question has to be, when you going to show me my money? Or the statement has to be, show me my money. And that's what is driving the conversations now. And we got to do it sooner than later.
And Leader McGhee, to jump in, I think some people will say that people are doing a great job, but I gotta err on the side of my constituents call every day yelling and screaming about this unemployment issue. So I gotta say that.
But can I say something, Senator, real quick? I think we cannot negate the fact that on this unemployment system that that has gone forth, we spent over $100 million.
180 million, 70 million.
$180 million to redo a system that still has its hangups. And again, and Leader McGhee said it best. I mean, there are individuals who are playing their part in ensuring that we at least get back to a place to where we can make sure we can process these claims and get people their money in a timely fashion. But $180 million, you would really think that of those dollars that we are moving at a much smoother pace than we were before we spent the $180 million. And maybe it will in the next week or so, but that's not the case. That's what's happening right now. I just need to get that out since we were talking about unemployment. I'm sorry. You
made me think of something, and we need to. We'll go into. It's 10:30. We'll go into a question. If we have some questions that have come up on the screen, I can't see them, but if we
there's some questions,
we'll answer those. But let me ask you this: you talked about $180 million. I just want to say this: if we had $180 million sitting around and we just finished the budget, why were we fighting so hard for some projects? Like a road project in West Palm Beach that was worth maybe $400,000 when we had $180 million we could have just spent.
No, hey, Senator, I got another question. And this is going to step on a few toes. So you might, I'm on the phone with my ride or die partners now. So we can talk, right? We can talk.
People can hear us though.
I know they can hear us, but they're going to be okay. Help me understand. We've been pushing for student loan debt forgiveness forever. And we've always been told from the federal level that we just don't have the money. all of a sudden now trillions of dollars are being printed and money is just appearing. But when one thing, the common thing that has affected more Americans than anything else we can possibly imagine, we can think of, that are causing Americans within the middle class to be now considered part of the working poor because of the student loans, the student loan debt. But yet we're able to find monies to give bailouts to corporations and other people. And this is not a hit at corporations, because I honestly believe, you know, you need like a well-oiled machine. Everybody and everything plays its part, and you give breaks to every other industry. My thing is, when are the people who are the true engine of this economic system based upon their spending power, when are they going to have an opportunity to get a bailout? And the student loan forgiveness would have been a perfect economic driver to allow for us to have more money to put back into our economy, as opposed to still allowing individuals to be saddled with that debt, when in fact we could have taken this opportunity right now and said, not only are we going to issue the CARES package, but inside of that CARES package is going to be relief for those who need student loan forgiveness, to allow for them to now use those monies to pay off other debts and things of that nature. That's it. That's all I wanted to say.
I'm glad you said it. So let's ask this question.
Shevrin, you got that look on your face like,
listen.
I'm trying to unmute my video.
I don't disagree with you. I mean, trust me, what you just said is total fact. So
and laid it out. So let me ask you.
I want to see a student loan forgiveness package within the next bailout package that we're going to see. The next package.
So why you ain't gonna see
I mean, I guess, and the least, and they don't want to give us a student loan forgiveness package for I mean, if they want to like narrow it down, yeah, at least to our essential workers, workers.
Yeah, like people who go to school. Teachers.
Absolutely. For our nurses, I don't care what anybody say. Give a student, give a stimulus package to for loan forgiveness for our nurses, for our doctors. They deserve it.
Everybody on the front line everybody who's on the front line, including the teachers, everybody who's on the front line right now who's risking their lives, they should automatically receive student loan forgiveness and wipe out the entire debt. And you know who else need to have their entire debt wiped out also? The men and women of our armed forces who are out there making sure that we're safe while we're asleep, and the men and women on the front line who are trying to control and contain this COVID-19 virus. So until that happens, again, we're going to keep beating the drums. But at some point, if you're going to be able to print $2 trillion overnight and another $4 trillion 3 days later and another $3 trillion down the road, and you're still talking about billions, come on, man. This is the time to have a reckoning that must bring forth a fruit that benefits the people who truly need it.
You all know we need to have another real conversation about some of that stuff. But let me ask you this question. It comes in from Pamela Brinson. Actually, I'll ask this question. It comes from Jay Burgess. Do you all think that the president or the governor is trying to expedite the opening of the country so that these benefits for both unemployment compensation federally and unemployment compensation in the state of Florida, the ones they haven't paid out, so they don't have to pay them out? Do you all think that's the case?
Just because you open up the economy doesn't mean that you're gonna have to pay people out.
Well, let's be absolutely clear here, Senator Powell. He's your president. He's your constituent. Why don't you walk over there and ask him?
Man, if I get close to, you can't get close to Mar-a-Lago. I'll write him a letter. He might, I have not tried. He may want to sit down with me. He may want to talk with me. You never know. I mean, because I'm an interesting person.
Yeah. But no, I mean, but Ben was right. Ben was right. And I'll be honest with you that just because you open up the economy doesn't mean that you're gonna owe people money, because people still do not have the money from the time frame that they lost their job. I mean, and listen, you talking about a lot of these individuals. 1.2 million people were service workers. 500,000 people are without a job, and now you're only talking about opening up restaurants by 25%. some of these individuals are still not going to have work. So some people still will be out of work. So what are we talking about here?
Hey, Rep. Jones, we could even take it a step further. Let's put it into like a picture, right? I believe the state of Wyoming only has about a little over 500,000 people for the entire state. There are just about as many people in the state of Florida unemployed than there are the population of Wyoming.
Period. Wow.
This is how you put it in true perspective, right? If we really want to talk about this and give the people a picture, we got to be upfront with them. We can take the amount of people in the state of Florida who are unemployed due to COVID-19 and due to the breakage of the system here, and pretty much match them up with those who are in the state of Wyoming.
Leader McGhee, either there's not a lot of people in Wyoming, or people here may not have been. I've never been to Wyoming. Sometimes, let's change the conversation.
We're gonna take a trip.
I got a question.
Okay.
Tommy Davis Johnson asked, we need to see the records for the bridge loan applications awarded. Representative Jones, thank you for recognizing the need for accountability of that $50 million. Where can we find this information for the bridge loan program of those who were awarded this money?
So
let's talk about it.
We asked for a public records request. I got word today that we will get the printout. Well, we'll get the email of those individuals who did receive the $50 million. But I do want to say something that Senator Rubio made clear on the call today. To those small businesses, I know a lot of small businesses are looking to go to the big banks to get your loans in order to get your some type of bridge loan program through the PPP. But there is an avenue for you to still get these loans by going through some of the community banks and to some of the credit unions. So don't think that you have to go to your Wells Fargo, to your Bank of America, and all those other places, Space Coast and some of these other places. You can still go to some of those places to get to get a loan for your business. As far as the bridge loan is concerned, myself and other individuals who are on this call right now, we asked 2 or 3 weeks ago, for the state to at least do another $425 million, and give or take, for the bridge loan program. I know it was an honor, but there are individuals who are fighting to make sure that some businesses do it. And if there is another slew of money that come out, I think that there needs to be a priority that's going out to some of our minority businesses, and especially like women-owned businesses, Black and Hispanic businesses, because a lot of those are the thriving forces of a lot of our communities.
Thank you, Rep. Jones. We're closely approaching our time. I need to do 2 things. I got one more question, Rep. Jones, that you and Leader McGhee will be very excellent to answer this question, and then we'll say our final thoughts and we'll get out. And I want to thank everybody for joining us tonight. We've had a lot of people who joined us on this conversation. Us 3 teaming up is a powerful thing. We represent Broward, Miami-Dade, and Palm Beach County. Representative Jones, you and I represent Florida A&M University, and Leader McGhee went to some HBCU up there. And where's that? The HU, is it?
Let's Senator Powell, let's be absolutely clear. I did not go to some HBCU. It is called Howard University, and it's located in Washington, D.C. And when you're ready, I'll give you a trip up there. And I think if I recall correctly, when you ran track and you also participated in some other sports, that school in Washington, D.C. used to put that whamming on you.
Listen,
put it out there.
I don't remember. Lance Gross actually was at y'all's school at the same time. But here we go. Last question, and we're gonna log off. We're gonna get off and let people go to bed because it's late. Rep. Jones, Leader McGhee, people are concerned. I've got a question that came into the chat room. People are concerned with rent and their landlords threatening to evict them immediately after the courts issue. We know the governor issued that order for another couple months to not be able to, or either the county, to not evict people. People are concerned that as soon as the courts open back up, they're going to be evicted. What kind of relief or what kind of support or help or comfort can we give people? And I'm asking truly because as a senator, I'm brainstorming at the same time for those people who have not been able to pay their rent and are being threatened to be evicted as soon as the courts open back up. Because as you know, we've put a stay on evictions, meaning that right now during this emergency, people cannot be evicted, but it does not stop the fact that if they owe rent, they still have to pay rent. And once the courts open back up, there's not been something that says you don't owe this amount of money. So if somebody says, let's say rent for in here in Palm Beach County, a 1-bedroom is $1,200, and if you don't pay rent for the next 2 months, when you are able to start working, or maybe not, your rent, you owe 3 months and you're going to owe $3,600 in one whop and you can't pay it. What do we do? Jones.
Well, thank you so much, Senator. So I'll say this, that when as we talk about as far as rent is concerned, I know Representative Escamani sent a letter today asking for relief for those, ask for relief. And I know Leader McGhee is working with the governor's office to do the same thing also. I'm sure there'll probably be some development in the coming days with considering that May 1st is coming, because I know our time is running out, but I know some relief is coming. So I think they should, I will hope that they will continue to watch and see what comes out of our caucus over the next 2 days. And hopefully,
yeah, and you're right. We're working on that. We're and another issue that goes hand in hand with that is also these property owners who have 3 and 4 properties, and they use those monies to subsidize their income.
Their income, yeah.
And so when they're not being paid by the renter, it creates a very interesting balance here. And so if we're going to compensate one to ensure that they're not evicted for lack of payment, then we must also look into paying for some sort of compensation to the landowner or the homeowners who are using those rent money to pay off the mortgages on those properties. So it's a delicate balance, and we must be mindful when we take that approach when we're asking the governor for relief, and we should be asking the governor for relief for both.
Yep.
All right, gentlemen, without further ado, I'm going to go ahead and let people know from me. I want to thank you all for joining tonight for another opportunity to speak with Leader McGhee, Representative Shevrin Jones, to discuss some of the important issues related to coronavirus and related to the state of Florida. As always, I'm grateful to join two of my, I say my freshman brothers, but more so my brothers throughout this process. We've gone through a lot. We've grown through a lot. And I just want to let everyone know out there, I've been able to sign about 300 letters this week congratulating students for graduating. And I've gotten some good feedback. I want to continue doing that. So if you have a high school senior, you are one, college, whatever, and you would like a letter from my office that says congratulations for graduating, I will be personally signing those and sending them to you, because I think without you being able to walk across the stage, it's just a little touch that we can do. It's been duplicated by a lot of my colleagues, and we just want to recognize the greatness that you all are doing. I always say a life of service is a life that counts. Thanks for watching, and I'll pass it to you, Representative McGhee.
Hey, just thank you everybody for tuning in, and thank the two brightest minds. I've been around in the legislative process for even having this opportunity, giving this opportunity to talk with you all. But at the end of the day, look, we just got to stay hopeful, stay prayerful. We're going to get through it. Our brothers and sisters was able to get through something similar in 1918 and be able to come out with their heads up and strong. We can do it also. Understand that this issue that we're fighting is not a Democrat or Republican issue. It's a human issue. And because it's a human issue, it must be attacked as a threat to our existence. And so let's continue to pray, continue to be hopeful, continue to stay educated. And, if you want to be great, serve as many people as possible. That's the principle. Push it over to Representative Jones.
I appreciate that. Well, and I'm being very quick because I know the time is late to Senator Powell. Thank you all for your friendship, and thank you for this time that we are actually able to come together. And for those who are watching, I know the hour is late, but for those who've been on since the beginning, and for those who are just joining possibly, the best thing that we can do is continue to take care of each other. And I think the reason why we are spending as much time as we're doing to present this type of information to our communities and to people is because that's what people are looking for right now. People are looking for information. People are looking for more of a hope message more than anything. And so I think that I'm hopeful that that's what we are providing to each of you. And hopefully we do this again next Tuesday at 9:30, and just continue to just spread the love to our constituents and to you all. And I'll say this, that there has never been a time that has come about that we have not been able to cross a difficult bridge. It seems that we always seem to find our way, and I think we'll find our way like we're doing right now.
Thank you. Good night, y'all.
Night.